Good morning, everyone. Just checking in if you can hear and see me. If I can have a few comments in the chat box. Wonderful. So welcome, everyone, to our June. I can't believe it's already at the end of June, but this is our June session for the Teach Educational Rounds. And today we will be talking about adapting motivational interviewing for clients with severe mental illness. And our faculty presenter today is Carolynne Cooper. So a few housekeeping rules to begin with. Just a reminder that if you're interested in obtaining a letter of completion for the Teach Educational Rounds, there are 3 requirements that you must do. And the first is having been registered for the webinar and having completed the pre-learning assessment. We would highly suggest that if you want this letter of completion, you please sign into this webinar using your first and last name, not as a guest. And then finally, please complete the evaluation and post-learning assessment that will be distributed after the webinar as well. As well, a reminder that our webinars are being live tweeted on Twitter, so you can follow us at the handle at PSQuitSmoking, and feel free to use the hashtag TeachWebinar if you are an avid tweeter as well. To provide you with a biography about our presenter, so Carolynne has worked as a therapist at the Center for Addiction and Mental Health for over 20 years in the addictions and mental health setting. She has a therapeutic approach that includes motivational interviewing, as well as a CBT-based approach, problem solving, and solution focused. Carolynne is involved in a number of teachings and training initiatives, primarily which focus on motivational interviewing and concurrent disorders. She is currently a social worker at CAMH's Problem Gambling Institute and is also a member of the MINT community. So the MINT community is a motivational and interviewing network of trainers. So we definitely have an expert with us today. So I'm just seeing that is everybody still okay in terms of hearing? Okay, so I was getting a bit conflicting stuff, but we're okay. What we want to also let you know is that there are any potential sources of bias outlined on the following slides have been mitigated by making this information accessible to you as well. So Carolynne does not have any disclosures. Now, the TEACH curriculum and slides are developed and compiled with funding from the Government of Ontario, specifically the Ministry of Health and Long-Term Care. The content of our slides are primarily based on evidence-based guidelines, including the following 3 sources listed on this slide. As a disclaimer, these materials, so that includes the presentation as well as any verbal conversation or any chat box discussion, are really only set aside as general principles and approaches to assessment and treatment pertaining to tobacco cessation interventions. They do not constitute clinical or other advice for specific situations and should not replace the need for individualized clinical assessment and treatment plans. So a few important rules for today. We are going to have a bit of a different format in the sense that we would like to have this as much as an interactive session as possible. So if you are comfortable and would like to continue, you will have the option of continuing to type in the chat box when our presenter Carolynne asks a question. However, if you have joined by teleconference and would like to provide live feedback on the phone, there are a certain number of things that you do need to follow, and I will recommend this to make sure that we can operate as smoothly as possible and that nobody has feedback. So the first thing you'll want to do to participate via the teleconference during the video session component of this webinar is make sure that you mute your computer speakers, and that can be found on the top. You can see we've kind of outlined for you. I'll bring the pointer live. You can see that needs to be turned off, so make sure it's not green. Then to make sure that you are speaking, press *1 on your telephone to unmute your line, sorry. And then when you are done speaking, please press *1 to mute your line. To ensure that everybody does have an opportunity, if there are multiple people who would like to participate via the teleconference, we'll ask that everybody's respectful and that we don't have, one or two people dominating the telephone conference. So make sure that everybody has an opportunity to participate. And again, if you just want to participate online through the computer, just feel free to type in the chat box. So we'll give this a try and hope it works, and if not, if we experience major issues, we will resort back to using the chat box. So bear with us. We thank you for your cooperation on this one. Okay, so before I hand it over to Carolynne, what I want to do is I want to take a moment to ask a few important questions to help us get a sense of as to where we are and where our participants are coming from. So take a moment to respond to the question as to where, or please indicate if you work for so whatever specific organization or group. Great. So I can see we have a bit of a distribution. I mean, we're seeing that we are seeing a few people coming from mental health agencies primarily. Perfect. Thanks so much for sharing that, everyone. As well, we'd like to find out from you, what is your current discipline? So give me a few seconds and I will make sure that is open for you. So we see quite a few social workers joining us today. Thank you, everyone. And we will then ask one last question to help get a sense of where everybody is coming from. And we'd like to find out, what region does your organization serve? So we're seeing a bit of a majority coming from the Toronto and Greater Toronto area, however, a wide distribution across all the different areas as well. And we have some people joining us from out of province as well. Great, thank you so much, everyone. So without further ado, I'm going to hand it over to Carolynne, and Carolynne will begin very shortly. Thank you.
Good afternoon, everyone. It's my pleasure to be with you this afternoon and to talk about a topic that I'm very, very interested and passionate about. I want to recognize the support and feedback of two of my fellow MINT colleagues, Stephanie Cohen, who works in the TEACH project in the nicotine clinic, and Tim Godden, who's done a lot of work with folks who have severe and persistent mental health concerns. I bring a range of experience, primarily working over the years with concurrent disorders, mostly mood, although having said that, bipolar concerns are kind of where I specialize, and also supporting folks who have schizophrenia, schizoaffective disorder. So I'm really interested in our topic for today, and I'm also interested in hearing a bit about your experience and where you're coming from. So I see there's maybe some concerns about sound, and I'm just going to consult with Leah about that. So what I wanted to invite you to do is just to think about your own clinical experience and to ask you what you found effective in working with this population. So please type your response in the chat box or press *1 on your telephone to unmute your line to participate by phone. So Judith is talking about active listening, being respectful. Crystal uses a cognitive behavioral approach. Okay, and Cynthia is talking about open-ended questions. So, okay, we have some folks who are using motivational interviewing as well and are really starting to talk about some of the spirits. Okay, that's fantastic. So being direct, engaging with people, adjusting your approach to kind of the unique needs of each of the individuals you work with. That's a comment from Helen. And starting to recognize that there is often a need with this population to build long-term relationships. Okay, so this is wonderful. It sounds like there's a broad range of experience that will hopefully make this a very rich kind of learning opportunity. We will be looking at a clinical scenario, and this is kind of to stimulate discussion and also to invite people to kind of share their own practice. This is kind of a recognition that, you know, much as Leah very graciously introduced me as an expert, we all bring our own expertise and experience in working with this population. And as we go through this webinar today, I will be using my MI skills and really kind of summarizing and highlighting some of the shifts that people have made in terms of looking at what works effectively in your practice and how to implement motivational interviewing with this population. Okay. So I thought I'd start out with just a little bit of a review in terms of looking at the definition of motivational interviewing. And so we have kind of three definitions. We talk about sort of a layperson's definition, where motivational interviewing is a collaborative, person-centered conversation where we're focusing on strengthening that individual's own commitment for change. We also talk about motivational interviewing as a way of being with people. And then I wanted to highlight this technical therapeutic definition that really talks about how motivational interviewing works. It's collaborative. There's always a goal. It's a style of communication where we're attending particularly to client language. And in terms of client language, we're attending to change talk or sustain talk. We're really looking to hear that kind of darn cat language where people are talking about, I really want to make a change with respect to my smoking. I maybe really need to cut back because I'm starting to experience health consequences. I want to do this because, you know, it's important for me to be around for my family sometimes, or to get the doctor off my back. There's a particular reason. And then the commitment side, the CAT piece, is starting to shift in terms of making a commitment. You know what? I think I could do this. Probably, maybe just for the next week. I could probably give it a try and cut back just by a couple cigarettes until I see you next time. Action and taking steps. So that's the particular type of language we're listening for. And this often happens by listening to the individual, as many of you have talked about in terms of building skills, building rapport, starting to enhance coping strategies, and exploring that person's reasons for a change within an atmosphere of acceptance and compassion. So that's where we really start to get into the spirit of motivational interviewing. And I've called this the heart of MI. And I liked this little graphic in terms of our heart, right? Really thinking about, we're working in partnership. We're not doing to someone else. We're collaborating. We're coming from a place of acceptance. Acceptance for the individual as who they really are versus who we'd ideally like them to be, which is often the catch. So I will speak as loud as I possibly can, and hopefully it won't blast Leah out of the room. So I'm seeing your comments. And maybe some of you will have to kind of turn the volume down if this is a bit too much. We talk about working from a place of compassion, and I know that as helpers This is a place where we often feel really acutely that it's really important for us to work in the client's best interest and to work alongside them. And finally, evocation. We're really interested in getting the client's ideas and hearing about what he or she thinks is going to be a good fit, hearing about their experience and their ideas as to what's going to work for them. So I just wanted to remind folks and just highlight for people who are maybe a little bit newer to this that we really focus on 4 foundational processes in motivational interviewing. And so these are engaging. And as many of you have pointed out, engagement is a place that we start with any client, but particularly with this population. We're starting to build a relationship that's trusting, that's collaborative. Then we start to kind of focus in and start to look at what are our goals for working together. Focusing may happen once and then go back, and we may shift focus over time as the client's needs change or sometimes as his or her situation changes. For example, housing improves, housing shifts, financial support shifts, those kinds of things. Evoking, we really want to get a real clear sense of the client's ideas about changing. And really throughout this process, start to understand what their dilemma is. And then starting to plan and move into the planning process is the phase where we're developing a change plan that the client is willing to engage with. So what we're going to do is we're going to look at the first 58 seconds of this video, and then we're going to stop it, and I'm hoping to have a conversation with folks. So I'm introducing you at this point to our client, whose name is Diane.
Hey, Diane. Tell me a little bit about what brought you here today.
The doctor said it would be good.
So your doctor thought this might help you in some way.
Yeah.
And
Okay, so I'm understanding that some folks who are listening in by phone really aren't able to access the sound for the video. So I'm going to ask, we can move on to one piece of this next discussion without the sound, and I'm going to ask you to just reflect on what you notice about this client and her presentation. What kind of stands out for you? So she's not necessarily fully engaged, she's withdrawn, there's not a lot of eye contact, she's looking down. Some folks are interpreting this as being guarded and disinterested. Krista has highlighted maybe she's depressed, she's fidgeting, her posture is not great, and she's maybe not interested in being in this appointment. Robert's highlighting she's really not so motivated to listen. Other people are talking about sort of a lack of energy, really seeming to be upset and very soft-spoken. Sophie has highlighted that her responses are slowed. And there's a hypothesis. Is she shy? Is she depressed? Is she disengaged? Or is she even interested in being there? And at this point, what I want to invite folks to consider is, what's your reaction when you start to meet someone who presents in this way? What comes up for you in terms of, as a clinician, how you feel, but also what you start to think when you have someone who's engaged in this kind of way? Yeah, we can move it for a second if you want. So Sophie is talking about she wants to fill the silence up, right? Kelly is highlighting that she knows from that moment she's on approval. She really needs to work to build rapport. Bridget is, oh, that's moving too fast for me. Bridget is highlighting that she's wondering about what's going on. Wow, lots of people are engaged in this, so this is wonderful to see. Some people are talking about waiting out the silence. Other people are trying to connect with this client on another level, not a clinician, trying to kind of shift the power balance to some extent. Other people are kind of wondering about finding a topic that she's interested and engaging in a discussion with her on that level and starting to bridge over to the topic at hand. People are really in kind of discussing this, starting to kind of identify some of the things that sometimes happen to us as clinicians when we start to engage, and I'll flip back, so don't worry about this, but starting to engage in the writing reflex. Whoops, what happened to that slide? Oh, it disappeared. Okay, so the writing reflex, and I'm wondering how many people are familiar with the writing reflex. The writing reflex is what comes up for us, right? When we internally start to feel like, this is uncomfortable for me, or I really want to help this person, and I'm not sure how things are going. And so this is where many of you really had wonderful kind of comments in terms of talking about what I need to do is connect with this person. What I need to do is bring kind of my best self and consider that this person may be more open than she presents in terms of her body posture and in terms of the amount of verbal content that she's sharing. The other thing that people also talked about is understanding that there's a lot of unknowns when someone presents to us for the first time. Even if we have a referral package, we don't always know what's going on in the individual or how someone with that particular diagnosis necessarily will present. And so this really emphasizes the idea of treating people, as unique individuals. Dora has talked about kind of working harder to be creative and engaging folks, and also being patient, kind of bringing that spirit of motivational interviewing, moving at our client's pace. I think that also the writing reflex, I know sometimes gets activated in myself when I'm feeling under a lot of pressure. Someone dropped in the last 15 minutes of their scheduled appointment, and I know, for example, that I have the next person scheduled for me at the top of the next hour. So this is lovely in terms of comments that some of the participants are making around building with trust, sitting with this person, recognizing that this is going to be a longitudinal, perhaps, contact, and that we want to balance that kind of needing to engage with the person with also recognizing that as healthcare professionals, we also need to do an assessment, get a picture of what their needs are, and recognizing that there's times when we need to adjust our communication style to respond better to this particular type of client. So people are really talking about trying to connect in terms of an empathic response. And so folks are starting to provide ideas, and I'm going to invite you to continue to do that in terms of where would you go next. So what we've heard is that the client's here because her doctors referred her. Where would you go from here next? So some folks have already started to posit that maybe they do some kind of icebreaker to get some sort of report, some sort of rapport going on. Other folks are starting to tune into the fact that maybe recognizing, hey, she actually came, and there's something to that. There's something maybe that we can affirm in that. Other people are kind of talking a bit about validating that she's made or affirming in terms of a motivational interviewing approach. People are also very, very curious about this woman in terms of really wondering and wanting to get a sense from her of why she thinks the doctor has referred her and why she's decided to attend the session. Other people are saying, you know what, it may be okay just to sit in silence for a moment. And folks are agreeing. Other people are really talking about, let's get a real sense of how she feels about being here. On one hand, she has come for the session. On the other hand, we want to get a sense of what's going on with her. So I'm wondering, what elements of motivational interviewing spirit have you seen to this point in time in the video, and how would you demonstrate those yourself? Everybody is different, right? And as I said before, this isn't an example of perfection, but more an example of a clinical scenario that may get us kind of started in terms of thinking and sharing our experiences. Okay, so other people are saying, you know, kind of share a more open body language, start to build a therapeutic rapport, and also share your observations. I'm guessing that folks may be kind of saying, it looks like you may be feeling a bit shy or uncomfortable in this session, and then checking in about that. Other people are sharing, you know, be careful to make sure you're talking in words that are understandable for her. So there's a recognition there that there may be something going on in terms of her cognitive capability, and in terms of, we know with some of the diagnoses that we're talking about, cognition is clearly impacted and affected. Other people are looking at open-ended questions. How do you feel about your health? How do you feel about being here? So I just wanted to attend, Leo. We did have a hand up, and I just wanted to check in. Okay, so Leah's just letting me know. People will type when you have questions and comments. So Jasmine has, Jasmine had a hand up, and so I'm hoping that you'll go ahead and type. Now, I'm hoping that folks are interested in seeing where I went from here, and again, this is a different kind of tack, but I'm going to ask folks to hold on for that. And I wanted to highlight a couple of things. So I wanted to share this work from one of my colleagues, Wayne Skinner, and some of you may know Wayne out in the community. Wayne talks about connecting, understanding, and proceeding in our work, and this is actually a lovely reflection of what each of you have typed in terms of your approach to working with this population. I also wanted to kind of compare this with the work of Kim Muser in terms of Kim Muser has written extensively on working with what's in the States called a dual diagnosis population in terms of engaging with the individuals, focusing on building that therapeutic alliance, which is exactly what people have been talking about. Recognizing that the engagement process with this population may be extended. And then starting to recognize that when we move on, and this idea incorporates Prochaska and DiClementi's concept of stages of change, the next stage is also that the therapeutic relationship is established, that there's some regular contact, but the person may not be quite willing to address the issue at hand. So, for example, they're smoking. And then kind of looking at the active treatment stage, where we're actively involved in supporting, coaching the client, where that decisional balance has shifted, and we're hearing clear motivational, we're hearing some of that darn talk, and then moving on to relapse prevention. So I see there's a question in terms of motivational interviewing different in pediatric versus adult population. And I don't know if there's people out there who are responding. I do want to see somebody typing. So I'd like to come back to that, if I may. I also wanted to just invite folks to respond to this poll in terms of what are some of the key skills that we use in motivational interviewing. And is there... Okay, so people are going to just respond in the chat box. Okay, so people are talking about empathy, reflective listening, using open-ended questions. Okay, so this is lovely, and we're seeing all the key MI skills in terms of the OR skills. Fantastic. Okay, so there's lots of questions here, and I'm going to try to address some of the questions as we go along, and I also wanted to kind of, I see a lot of questions coming up about using motivational interviewing with a pediatric population and also with teens. So there's been some literature that's been written, and certainly clinically in terms of using motivational interviewing with adolescents. I work in a gambling clinic where we do work with a range of young adults, we call them. So people from 16 to 25, where more often gaming is having a very negative impact on their lives. For this population, we also see folks who have some autistic spectrum disorder, some ADD, some ADHD, and I gotta say, to some extent, it really depends on the individual. So, for example, I am able to use motivational interviewing, and it works like a dream in terms of engaging with this population. I've also been involved in projects in the community where we've implemented MI, and there has been some challenges and also a lot of success. Certainly, as with any population, you're tweaking it to the individuals you work with. I know that for some folks where autistic spectrum disorder is, they're on that continuum, motivational interviewing really needs to be adapted in terms of offering choice, for example, in open-ended questions. So one thing we might kind of say, and this isn't so different from working with this population, is saying, you know, when you start to look at, you know, where would you like to see things change? Sometimes we're saying, would you like to cut back, or would you like to quit, or did you have something else in mind? So we're offering a range of choice and also offering an open-ended component. Okay. People are talking about encourage readiness for change, being aware of change, and starting to use
What do you
reflective
think?
strategies. So what I would like to do is I would like to go back to the video if we may, and I'm going to invite folks to watch the next point, and we're going to play through to 6 minutes and 37 seconds, so we're going to play about another 5 minutes. And as we do this, I have a few questions. I'm going to ask you to kind of note some of the motivational interviewing strategies that you see, and then I'm going to really open things up and ask you to talk a bit about your own experience and your own clinical judgment in terms of where you take things from here.
Volunteer with kids.
So for you, your health is a concern, and the volunteer work that you do somehow gets impacted by your smoking.
Kids like, when they smell it,
they kind of step back from you or move away in some way. And it looks like that doesn't feel good.
No.
So smoking's having an impact on your life in ways that you're not happy with right now.
Yeah.
I'm wondering, Diane, would it be okay if I asked you to give me a bit of a picture about your smoking?
Picture?
Yeah. So I'm wondering if you could tell me a little bit about, how smoking fits into your life as you go through kind of your average day.
I don't know. I get up, have a cigarette, brush my teeth, need a cigarette. I don't know, I guess whatever I do, I need a cigarette.
So cigarettes kind of are sprinkled throughout your day. It sounds like maybe just after you put your feet on the floor, you have your first smoke.
Yeah.
And if I were to ask you how much you smoke over the course of a day, how much would that be?
Oh.
Your average day.
36 cigarettes.
So you're smoking about a pack and a half, maybe sometimes more, maybe sometimes less.
Yeah.
And tell me a little bit, you said your doctors told you recently you have COPD.
COPD, yeah.
What was that like to find out about?
I guess a little scary.
got you worried maybe about your future?
Yeah.
And you trust your doctor enough to come in. You trust your doctor enough to come in and to talk to somebody about where you're at with your smoking.
So thank you very much, because I see somebody's working very hard at transcribing this interview, and it will be available after the webinar. So I'm wondering, what strikes you as you go through, and people have commented on this, so I just wanted to make sure that's available for folks. So people are noticing both MI skills in terms of asking open-ended questions, asking permission, trying to, while the client may be uncomfortable in this context, trying to offer her as much autonomy as possible. Doing some or offering some reflections, and the kinds of reflections that were offered, would you say that they were simple or complex? Was there one that kind of stood out for the folks who did have audio for this? One person kind of highlighted that there was speech kind of mirroring the client's speech, and that there was some comfort with silence. Other people are saying that part of what's going on is there's kind of a non-threatening, really trying to help connect with the client and engage with her. There's some question for some folks in terms of how much help does this client want, and how much is she a mandated client? And I think that's typical in our kind of context, right? We're never really sure initially how much motivation is internal and how much is external. So what I wanted to invite folks to, so we've got some reflection that what we're doing here is that there's been some use of or skills, that there's been some demonstration of motivational interviewing spirit in terms of reinforcing autonomy, and being comfortable with silence. One of the things that people kind of highlighted was just exploring the client's feelings and really pacing and using a tone that matches that of the client. We've asked evocative questions, and moving a little bit beyond just what the client has said. We also got some, so what we've been doing is we've kind of chunked the video out. We're not playing the whole video. We're running pieces and inviting people to discuss and comment. So I'm wondering if people noticed the client's body language. She rolled her eyes just before the final comment. And what I'm curious about is
Doctor made the
where
appointment.
people would go from here. I think there's lots of multiple
So the doctor made
paths.
the appointment.
And I'd really
at
be
the same
interested in
time,
hearing a little bit about
decided
what your thoughts are and what you might say, what you might reflect, and where you might take things from here in terms of using an MI perspective.
So I'm guessing that part of what happens
So there's some
with
reflection
your
that
COPD
that people
and
have noticed in
volunteering with
terms of the
kids
client's presentation
is
that
it-
she seems
it gets
incredibly
hard to
depressed,
sometimes
has
run
a bad
around and
cough, and maybe
with them.
understanding her medical condition is an important
Yeah.
kind of direction to go in. Other folks are saying, ask an open-ended question. What got you here? What's your key reason for being here?
I'm wondering if there may have been times
And also
in the
validating that
past
others must have made some
when smoking wasn't a
demands
part
that
of your
got
life.
her here, and recognizing that while the motivation may not have been exclusively internal, offering
There's
an
always been
affirmation
someone smoking around me,
could be really helpful.
even before I started smoking.
So other folks are really
So
curious
maybe
about
family, maybe friends.
what her motivation
You
and
kinda
what
grew
her
up seeing people
desire,
smoking.
and I think that's what your question is,
And for
Dora.
you,
Maybe
when did you
using
start
sort of a
smoking?
scaling question in terms of
13.
asking, if I had you answer this weird question, I'm going to ask
been
you to
about
think of a thermometer
23
from
years.
0 to kind of 10. The top of the thermometer is 10. How
And
much
it's been
do you
steady
want to make change
in
in
your
your
life.
smoking? So that's a variation
much.
in terms of a scaling question. Sometimes using
couple
visuals
weeks
are
when-
really helpful. Sometimes just making it something that's very practical.
Couldn't get
So
a
a
cigarette.
thermometer, also sometimes talking about a glass of water. Lots of us have glasses and bottles of water in the office, and we kind of say, if you were to imagine this glass
I was in the
being
hospital.
full, half full, 3/4 full, where would you put yourself? So other people are thinking about direct questioning and offering continued support, but also
So
kind
you
of
were maybe
recognizing
so
she may
ill
not
that
be
you couldn't
willing
go
to
outside.
continue at this point. People are curious about her symptoms, her observed symptoms in terms of her cough. So what I'd like to do is I'd like to restart the video if we can,
Not smoking. What was it?
and we're going to look at this for 4 minutes.
Hell.
So we're going to play till 10:40. And And again, I'm going to ask
It was
folks
almost torture.
to highlight some of the OR strategies used.
It's like so irritable. It's hard.
So you really had some withdrawal.
Yeah.
And at the same time, from the sounds of things, you got through it.
Yes.
So folks have been highlighting in terms of noticing some complex reflections, some other kind of MI strategies, I just wanted to ask folks, there was an affirmation there just before we paused the video. People are reflecting on a range of things. So just to kind of go back a bit, people have posited that the eye rolling that we noticed just before we paused last time and picked up again may have been about a wide range of things in terms of cultural differences. It may be about a difference in terms of really feeling comfortable and wanting to explore her smoking. Other things that people have been highlighting are sort of asking, just directly saying, hey, you rolled your eyes. I'm really curious. What's going on that happened? People have reflected that they've picked up on some complex reflections. Things like you seem like you've heard about quitting before. I'm guessing this isn't the first time. Also kind of looking at and being really, really open and curious about hearing about what's going on. People have commented on noticing that the client has actually moved forward. So her position in the chair has changed significantly. And that she's a little bit more engaged, but other people are kind of sensing that something else is on her mind, maybe. In terms of the affirmation, people are highlighting that it's strength-based. So we know that making affirmations are exceptionally important for this kind of population. People who may never have had anyone who's really believed in their potential, their self-efficacy, in other words, that they may be able to make a shift if that's what they want to do. We are often lending clients our hope when we're making an affirmation and really noticing something that we appreciate about themselves. Often with a population where it's severe and complex mental health concerns, we want to make it clear and as concrete as possible. We haven't moved far enough into the video to see a lot more, but if the client were to reflect delusional or non-logical material, I wouldn't reflect the delusion because we, of course, don't want to reinforce that. I may reflect the feeling. So I think about a client I've worked with in the past where they had a lot of trouble getting in because they were sure that their neighbor had put an implant in them. And so they saw not only everything the client saw, but they also heard and really had a clear sense of what the client was feeling. They were sure it was their neighbor. So instead of reflecting on that whole story, I was able to say, wow, you really showed a lot of courage in coming here today, even though you're not sure if it's safe. And for that client, that really opened up a connection, a kind of understanding that I might be getting where she was coming from. Other people have identified that they're curious about housing, that they're really interested in knowing a little bit more about what's going on with this person. They really are reflecting kind of some of the values of motivational interviewing in terms of non-judgmental tone,